the first thing I'd like to remind you is that right after this meeting, we have a second, well, not right after, but a short bit after, we have the secondary school reopening meeting, which will be led by Michael Hirsch, who's a secondary school principal, and he will follow up on some things, but go a little bit deeper in certain aspects for in the secondary school context. And then next week on Monday, we have two meetings that June Vandenbos, the primary school principal, will be leading, which also will kind of continue the conversation we had this morning, but get into more detail that's relevant to that particular division. So we do hope that you can join us for any and all of those sessions that are relevant to you. And we will be recording them and distributing those recordings for the sake of good communication at a time where there's a lot happening at KIS and probably in all of our lives. So we're doing our best to communicate with you, and also giving you an opportunity to communicate with us so that we can make sure that we're all aligned in our thinking as we start. So the contents of this particular slide deck, very similar to what has been shared previously, but I want to just run through it. I will go maybe a little bit faster in some of it because I know it will be gone over in a bit more detail in the divisional meetings. But at the end of this session, and I think after each section actually, we'll be taking questions on that particular section rather than waiting for everything at the end. I think today we'll kind of go a little section by section for questions that fit that section. Okay, so hopefully you have taken a look at this slide that was sent on Friday. I think that it's important to realize that KIS is a community that has particular ways of operating and particular priorities. And, you know, it's fair to say that all schools have some of the shared priorities that we do, but we're not exactly like every school, and nor would other schools say that as well. So what I want to emphasize with this slide is that over any other consideration, safety has been first and foremost and continues to be what's driving this plan. Yes, learning, teaching and learning is also a very big key component. We don't want the remote learning that is happening to dip, and we want there to be a seamless engagement with the curriculum once we come back onto campus. But it's safety that is the predominant factor in most of the decisions that we've been making towards this reopening. On the previous slide, there's a bullet that says that no one intervention is a guarantee of safety. And that then is the backdrop to why we use this Swiss cheese model diagram to make sure that our community knows that we really have lots of different interventions are in place, and just one of them wouldn't be enough, but a variety of them used in combination is quite a powerful safeguarding tool. So the ones that you see here, I don't think will surprise you, but we are being quite careful in our reopening to make sure that the government regulations are being followed fully, and that in cases where there isn't definite guidance in terms of something that we know to be a verified safeguard measure, we have implemented some ourselves out of an abundance of caution for this reopening. Okay, again, just an overview here. The primary school and the secondary school do have different schedules. We have worked to get them as aligned as possible. But in the end, there were some considerations that made it impossible to be as perfectly aligned as we know every parent, every family would have liked for their particular circumstances. But we do want to know about those situations, and I know that there's every effort being made to make this as convenient as possible too, but that hasn't been our main consideration. Again, it's been safety. So the primary school, again, has a group 1 will be coming on Monday and Tuesday, and group 2 will be coming on Thursday and Friday. Because those 2 groups are only at school twice a week, they will only be required to have 1 ATK test a week. So they, and the night before their 2-day time on campus. So we'll clarify that in the ATK session, but or the ATK section, but I wanted to mention that now. The secondary school involved, but you can see there's a week A and a week B, and that is the grades for each of those groups are designated. In that plan, there would be times that some of those students would not attend on-campus classes in a given week, but they would be, of course, in school with the remote learning program. But I know that both Michael and June will go into more detail about that in their sessions. Okay, we have really done quite an extensive job on our drop-off and pickup times and logistics. And there are some grades that are a little bit more involved. But again, I'm going to leave that to the division meetings to get into the details there. One thing, though, I do want to emphasize is that we are needing to be quite specific about the entrance. So the primary school students need to come through the primary gate, and the secondary school students need to come through the car park entrance. No exceptions to that. And again, it's in the interest of safety. Our plan is not designed to be the most convenient plan, but it is designed to be as safe as we can get it. And so the next few slides, and again, this slide deck was sent on Friday, but we'll do so again tomorrow, gives you specific drop-off and pickup information about each grade level or range of grade levels. So we have a specific EY1, EY2, EY3, grade 1 through grade 5, EY1 through grade 3 pickup, and bus dismissal. So you can see there are a range of circumstances depending on the grade of your student. So read the slide very carefully, attend the divisional session so that if you have any questions, specific questions about your set of circumstances regarding drop off or pick up, we will definitely work to answer that, but that will be something best asked of the principal or the vice principal of each division. So we have received questions since the reopening plan was distributed on Friday, and we'll work to answer some of them right now, knowing that we will have some time for anyone in this call to ask questions as well. But here are some that we've been hearing that we thought we would answer now. The first one is, will after school activities be offered on campus? Well, right now, when we're really concentrating on a safe and smooth reopening, we're not going to have after school activities on campus until further notice. But as soon as the security measures improve, we gain confidence with our reopening, then we would certainly want to do that as soon as we can and as soon as it's safe to do so. The second question is, can I switch the days my children go to school so they are on the same schedule? And so you can see that we've got some restrictions there. Unfortunately, we've had to set some schedules. In the secondary school, in both divisions, that's the case. There may be some flexibility depending on the request, but you would need to make that request of the principals in those divisions. Are parents allowed on campus? So we have two, what I would call semi-exceptions to this. My short answer is, at this time, parents are not allowed on campus. That again, it has been something that is part of the regulations. We are permitted some exceptions because of particular circumstances, and one of those happens to be with the EY1, EY2, and EY3 parents. That coming onto campus does not include coming into a building, but it means that those families, one parent per child in those grades, would be permitted to use an outdoor route, which we will have established to drop off their children. If the early years, all of our children have been out of practice for on campus, but our youngest learners have not ever been to school before. And so we need to have a plan for them that is safe, but that attends to their needs. Uniform purchases, we do have provisions for that. That needs to be arranged. A lot of it are for new families who haven't had the opportunity to get a uniform or other routine things. If you have a need or a question, you can reach out to school services, and we can arrange a time for you to come on, but we would not do so when there are classes in session. Another question that has been asked of us is, it's a ventilation question, it looks like, on the school buses. Can windows be open partially? Certainly, we're looking at how to make sure that the ventilation is good on the buses and in the classrooms, but there are safety considerations there. So there will be some watchful eyes about that, and certainly as you see the doors opening, get air in there. Perhaps the windows are lower to crack to keep that ventilation there. But if you have any specific questions about the buses, you can contact Kunja, who is our Director of School Services. The next question is, why is KIS reopening later than some other schools? Well, that has been a decision, again, that has been centered around safety. What we feel in our community is going to allow us to be safe and measured and have the reopening go as we want it to. And, as I've said in other calls, I speak with heads regularly, and I'm aware that there are some schools that have started earlier. We look at what every school is doing. I'm pretty aware of what they're doing, but we also follow all government regulations. And if there's a benefit, if there is some doubt about what we should do, we investigate that with the appropriate agency and then make a site-based decision on what we think is the best action for KIS. So with safety, again, the #1 priority, that's why we've decided we need to open a little bit later than some of the schools that have begun to. But with November 1st just around the corner for our secondary school students, and for November 8th not too far, it will be just before we know it, we will be back here and in a safe environment. Okay, I'm going to now start the section on ATK, which there's been a lot of questions, and quite frankly, we had a level of detail to continue to refine with this, but we are at a place where we can give you some of that detail. There's also been a lot of work behind the scenes to try to help the conveniences of this for families, because we know it is a unusual request that is being made, asked of families at schools around the city, is to do the ATK tests. So we're going to talk a little bit about that. Yesterday, a letter was sent that had some information. I think that is all still correct. But there are a few things I've added to this slide to just clarify some questions. The KIS will provide 2 weeks of ATK test kits, and then after those 2 weeks, we'll facilitate any ATK kits that families would like to get at the cost that KIS is able to get. I mentioned that it's 45 baht. That is true, but that's not including the VAT. So that when you see a final price that's a little bit higher than 45, it's because of the tax, and I think it'll be somewhere around 50 baht when all of that is added to it. The other note I wanted to be sure is clear with our families is that the ATK kits, both the free ones that the school would be, or the school, the ones that the school are providing free of charge, and then also the ones that the school will be facilitating at cost, are provided only for the days that the students would be scheduled, so to come to classes. So for primary school students, since they only have to have 1 ATK test per week because of that schedule, then the school will be providing 1 kit per week for those students because they're only needing to come that one time. So it's not necessarily going to be the same number of kits for each student, but it's depending on the schedule that they're going to be required to follow. If you saw the note yesterday, you saw some good news. We have determined that, and again, in our carefulness, knowing that there have been schools using saliva tests, we wanted to be very careful. So we now know that this is something that we can do, is to permit saliva ATK tests for grades EY1 to grade 5 is permitted. The school will provide the kits through grade 2. So if you have children in grades 3, 4, and 5, and it's really important to your family to have the saliva test, then you will need to get those tests on your own, but you would be able to use them. The nasal swab test kits for grades 6 to 12 are the only option, and that is part of that decision is supply for us and be able to have the supply we need long-term to be able to facilitate those tests. And it's also based on advice we've been getting from government sources. So that has led to a decision that we have made, a site-based decision that we believe is in the best interest of our community. We will begin the kit distribution on November 1st, which is next week, which means for those students coming to school on Monday, you will need to find a test in order to upload that on Sunday night on our health portal, which we'll show you a little demo of in just a second. Okay, and here is the demo. So I think this is just a few minutes, but it will give you a good overview of what your experience as parents will be like using our health portal to upload ATK test results.
This is a demonstration of a KISS Health Portal. You can access this portal using your phone, laptop, iPad, or your computer desktop. First, we begin by opening our browser on the phone. Type in the health portal link, which is health.kis.ac.th. Then press enter. And under parent login, enter your child's 9-digit student ID. And to upload the result, scroll down to the bottom and click on the button that says ATK results, click here. Now, because this is a demo site, you are seeing a demo student. And for EY 1, 2, and 3 parents, there will also be parent profile appearing under your child's profile. To upload the result, you click on the picture of your child. And I want to give this result a negative. I enter the brand, the ATK brand I use for testing. I then select the testing method. And please note that for secondary student, there will only be one method. I then have to attach the picture of the test result. I click on the picture of the cloud and select the picture of my test. And please note that before you take the picture of the result, please write your child's name and the date of the test. And then I press confirm and proceed. I'm being asked here to submit 3 responses. Just going to do that quickly. And for the last part, you have to enter the email address that you would like to receive the school pass. There are up to 3 email addresses that you can enter, but I'm just going to put in 1 email. And then I click submit and OK. Now you won't receive the school pass straight away. The school administrator will need to review and approve your submission. And once that's approved, you will receive an email sent to your email address, which I'm going to check in my inbox. And there you go. The pass has arrived. And I want to see what it looks like. So I click to view. And this is my child's school pass. I can choose to take a screenshot of this pass and keep it on my phone. And I will need to show this pass along with the KISS smart card to our security guard. You will need to submit the result for each of your child. And for your convenience, we have posted the ATK test dates on the home page of this portal. So make sure you check this message before taking the test. Thank you.
Big thanks to Ja for preparing that for us, and we will have that in our KISS letter as well.
This is a demonstration of a KISS Health Portal. You can.
So I know there are a few, as I said at the beginning, we have likely a number of questions on this topic. So I'm going to move through the slides in this section, and then at the end of this section, Becky Fox, who is our Director for Teaching and Learning, is helping to look at those questions. I think the principals also are answering on the chat so that we can answer as many questions as possible with the time that we have. So the next, a lot of what you saw in the video, The health portal is going to be the mechanism for sharing the test results, the ATK test results with the school the night before your child is to come to school, but not every night. So for those, if you, the rule of thumb is if your child is going to be on campus for 2 days or less that week, then they will need to upload the results the night before the first day that they're attending. If they are more than 2 days, then there will be 2 occasions that they will have to upload the results. That will be on Sunday night and on Wednesday night. Both of those days would be the 2 days that we are needing to get test results, not only from students, but also faculty and staff as well. Okay, this Monday, just to ensure this is really clear, everyone who is coming onto campus beginning on Monday must have uploaded proof of ATK testing. And again, we will be sending all of this through KISS letter tomorrow and maybe even today to get it to you as soon as we can. Okay, so a lot of this is was actually demonstrated in the demo, but you will see that it's written here as well. The if you look at number 2, when your test result is done, then having your name, the name, grade, student ID number, and date and time of the test on a piece of paper that is included in the photo along with the test is part of what we're asking everyone to do before they upload it. Okay, and the other note you see here, if the test is not done ahead of time, that individual, whether they're a student or a staff member, will not be allowed on campus. So it's, you know, it's something we have to all adjust to. Hopefully this portal makes it convenient, much more convenient than other options for arranging this sort of thing. But we really do appreciate your help and understand that the first week we may have a little bit of bumps, but that's part of what we've been trying to do before reopening, is to get this system working well, and it seems to be working very well. So there's one question about vaccination, which kind of fits into this category, I suppose. And is the app more enough for those people that have don't have it on a card or in a booklet or something? In that case, you would just do a screen capture, take a photo, follow all the other instructions so that we can see evidence of that. If it's entirely in Thai, that should be okay too. We will make sure that we are able to verify that regardless of the language. Okay, so I think before we go to the next section, we do have some questions here. I'll go ahead and answer them, and then we will take questions from the chat room. First question is, which ATK test will the school allow? Essentially, if it's been approved by the Thai FDA, we will accept it. The exception is there's a saliva test that I guess is it is shaped like a lollipop. We do not have clear evidence that those are approved. So at this time, those would not be approved for those primary school students opting for the saliva test. But the other ones you see there, as long as they're FDA approved, would be ones that we would accept. The next question, why doesn't KIS accept saliva tests for secondary students? As I alluded to earlier, we are fully complying with government regulations. And when those regulations aren't as clear as we would like, then we continue to seek advice from those relevant authorities. So we, based on that advice, we feel that it's best to maximize the use of the nasal swab tests and minimize the use of the saliva test. And the minimizing of the saliva test, the decision made that we're seeing EY1 to grade 2 is kind of that zone and that where we will be a little bit more permissive about that test. And then grades 3, 4, and 5 permitted. But that's the balance that we're striking based on the advice that we're receiving. Next question, how does the school and parents know that the kids are safe by showing a negative ATK test result? Well, we do, obviously our system is an honor system. This is the system we're using with our health portal is very much like schools around the city are using. And I think by requiring that we have the date, the time of the uploaded test, that is another assurance. But we are trusting our community to make sure this is in all of our best interest to follow the instructions. And we are required to have ATK tests. So that's one of the reasons. And then, keeping it in perspective, the ATK test is not our only intervention. We have all those other slices of the Swiss cheese model in place should there be anything that doesn't go quite as planned. But we think the risks are very, very low in that regard. Okay, so before we go to the next section, Becky and Mike and June, I haven't been looking myself at the chats because I've been presenting. But if maybe we can, Becky, if you can just start reading some of the questions, and then the four of us can work to answer them.
Yes, I'll try to do that. I think you've clarified some of the points. Could you just clarify again, Paul, that there are two types of saliva ATK tests. The lollipop type is the one that when we don't think is approved. The one where you spit in a little pot has been approved by the Thai FDA, but can you just clarify that as a school that we are only accepting that up to grade 5?
Sure. So in terms of what we will accept, given family choice, is that any grade in the primary school would be allowed to submit a saliva test, but not the lollipop style. The other style, I guess, as you eloquently put it, Becky, the spit in the cup style, that would be the one that you could use. Now the school is, in terms of the 2-week provisions of kit, and then after helping to facilitate bulk orders of kits for families, we are doing that for saliva tests only up to grade 2. We are providing and facilitating and providing free kits for grades 3 and up, which would be the nasal swab. But if a family in grade 3, 4, and 5 is very concerned about that and would like to use the saliva approved saliva test kit, then they could do so, but they would have to get that on their own. The only option for grade 6 to grade 12 is the nasal swab test.
Okay, thank you. And just to clarify, the school is providing 2 weeks worth of tests. So is that 2 weeks for primary who take it once a week and 2 weeks for secondary who take it twice a week?
So it's for 2 weeks of school for that child. So it would be starting November 1st. And then from that point onward, 2 weeks, based on the schedule for that student. In the secondary school then, a 6th grade student compared to an 11th grade student might have a different schedule week by week. It would be, the number of kits would be based on the number of days that they're required to be.
Paul, sorry. We have school starting on November 1st, and I just wanted to clarify, families will need to sort out their first initial test that they will need to administer on October 31st because of just the supply line issues. After that, they'll become available.
Yeah, that's right. So the distribution will come in the week of November 1st. That first time at least has to be done, as I mentioned earlier, it would have to be done by families on their own. Is that, have I cleared that up, Becky, do you think?
Yeah, so I think so. So for the students coming in on Monday, you will have to buy their test and upload it on Sunday evening, by Sunday evening before they come to school to get their school pass. There's a few questions about how the PYP students will collect their tests and when those tests will be available. So do we have them at school yet? We don't, do we? So we need to let parents know.
Yeah, so we don't have that quite yet, but I think by Monday in those meetings that are at the divisional level, we'll have that information for you, for those primary school parents.
Yeah, we will put them in the child's backpack and send them home like we used to do, letters and things like that. So anything that's coming home will go in your child's backpack. So check it each night and we'll make sure it comes home each night. And then that will be in there. There'll be other information as well. And so we'll make sure that you get everything that you need.
And a question that's just come in, we will share with parents the information about which tests are acceptable, and maybe if we can share supplier information somebody is requesting. There was a question about why the poor secondary students have to test twice a week. So do all the staff and teachers. That's the government regulation. We're in Bangkok and that's what we have to do at the moment. So hopefully we will go from, I think we're still dark red, and if we go down to orange, then we can maybe not have to stick a stick up our nose twice a week. We're all looking forward to that moment.
And in the primary school, sorry, in the primary school, it's once a week because your children are only in school for 2 days. If they were in for the week, it would be twice a week. But because of how the schedule is organized, your child only has to do it once a week. Their teachers have to do it twice a week.
The rule of thumb, again, if you're on campus for 2 days or less, it's one ATK test. If it's over 2 days, then it's 2 tests. So Sunday night and Wednesday night being the times that the tests need to be taken and submitted.
What happens if you miss the ATK? If you forget to do it, you don't upload it, what will happen? But your child still comes to school.
Well, I think that if you remember to do it, then you need to do it as soon as possible. But I would call school services and let JAWS office know that.
And we can't access the school without it, so we would have to work out a way to do that.
Right. I mean, part of the system, of course, is, and part of these sessions is to really have everyone understand that this is quite an important thing for the functioning of the school. So we really do need to have everybody do this. You know, we do have some backup measures that we will have at the ready, because we realize that for a school of this size, we need to have thought about all contingencies. But I think in terms of in the chance that it is forgotten, I would just really stress to everyone, do everything you can to not forget and really prioritize this, because it's quite, I mean, this is an important safety measure for us, not only because it's a safe thing that we need to all do for the sake of all of us, but it's also a government requirement.
So you'll need that school pass to access school, and to get that you need a negative test. There's a few questions about that portal. How long does it take to generate a pass? Is there a deadline on the day? So I can quickly answer that. You need to have that pass before you get on the school bus or before you get to the gate to come into school. And then a couple of parents are asking whether the portal and the school pass can be integrated into the smart card.
We're not able to do that at the moment. So the systems that we have in place are the ones we're going to start with. We're always open to think about the most efficient way of doing things. And so I think we'll continue to investigate that. And if the reopening continues for a long period of time, as we've designed it now, then we'll continue to look at those options. But for now, the systems that we're describing are the ones we'll need to use.
And there was a flurry of questions that some people may have missed about primary school students not having mobile phones, cell phones, and not being able to show a pass. So June, do you want to just share with everyone what you wrote in the chat?
Okay, for our primary school students, it will be a drive-through drop-off. So an adult will be bringing their child to school, whether it be yourself or a driver or a relative. They will need to have the pass on their phones. So we will have two people helping, and one person will be taking a look at the pass and the other person will be assisting your child out of the car and into school. So it is we have a plan in place. I'm sure it'll take us a couple of days to get it running smoothly, but the adult does need to show the pass on their phone, or alternatively, you can print it out and give it to your child, and we will take that when we let the children into school. But we cannot allow anybody on campus without a negative test. So if perhaps you do the uploading and you'll have a driver who brings your child in, or maybe grandma brings the child in, then you will need to forward that to their phone, and they can then show that on arrival.
One question that I can answer that I'm not sure has been asked, but just clarification. The 8 p.m. Deadline for Sunday night and Wednesday night to submit the test is because the school pass isn't immediately sent to you. We have personnel at the school who will actually be working in those hours after 8 to approve. And then it is just verification that we have what we need, that all is in order. And then we will hit a button on the back side of that portal, and that's what will generate the school pass, which will be sent to you. So if you upload the portal, and it was in the video that we looked at together, you don't be alarmed if you don't receive your school pass immediately after that. It will be coming, but it may be sometime before you get the pass.
How do we guarantee that the tests are good and updated? What if people try to trick the system with a repeated negative test showing the same stick?
Well, we're definitely watching for that. I think that if we have any evidence that something like that, or any suspicion that something like that will happen, well, we will make sure that we give that some attention. If the stick has what would be ideal is to write the information on the stick and put that information right on the stick. If the nature of the test kit doesn't allow for that, then that's why we're suggesting a piece of paper that is next to the stick that has the name, dates, student number. That photograph then is used. So yes, I don't think any of us are naive that it's possible that you could trick the system. There's lots of systems in our lives that we could trick if we wanted to, and I think we're starting out this with the very best of intentions, knowing that we're all in this together in terms of safety. So do feel confident that all of us will do the test as we're being asked to.
Paul, can I just piggyback on that one quick? We actually looked at the idea of having the nurse do the tests for us, and it's not logistically possible to do it because we'd have to be testing approximately 800 to 1,000 people a week via the nurse's office. And so the quantity of time it would take to do that, the level of disruption it would take to do that, and then the way that that would affect all of our bubbles and social distancing, it just makes it not practical or possible. I think the other thing to keep in mind is that we do have reason to believe that we can trust each other as a community. We're a responsible group of people, but on top of that, the ATK test is not the primary means for keeping our schools safe. The primary means for keeping our schools safe is that Swiss cheese approach. So it's an ATK test result that's happening in addition to active hand washing, in addition to social distancing, in addition to mask wearing, and in addition to other provisions. And then on top of that, in the secondary school, we see that we have very high rates of vaccination in place and occurring as we speak. So if we were not wearing masks and the only provision we had in place was the ATK test, then I think I would agree there'd be reasons for concern. But because it's one of many, many provisions, I think we can lower our anxiety levels on that one.
Thanks, Mike. There are other questions that are non-ATK related. Some may be answered as you go through.
Okay.
Do you want to take them later?
Let me go ahead and continue. If you could just help keep an eye on the questions that we've not yet answered, and hopefully it does come up, and then we can catch things in the end. I think just so everyone's aware too, the intention here is that not every question is likely to be answered in this session, which is an hour and 15 minutes, but that's why we have designed subsequent sessions to catch some of those more detailed questions. I wanted to share with you quickly, just for your information, the results of the most recent survey that we sent on Friday with the question, will you be sending your child or your children to school? So you can see there that we have about 82% of you who have indicated that you would be doing that. The 4% other, I think, are people that responded with some comments. So it wasn't as cleanly blue or red, but essentially all the other would be mostly blue. So I think that takes it to more to about 84%. And we had 566 respondents. We're still, for grade levels that we have not received sufficient indication for our planning, then we're following up this week to try to get that confidence of who to expect. Okay, I just want to go over again the campus access. Some of this will be attended to in the divisional meetings. But again, you can see we have three screening zones, excuse me. One here in the car park area. Every secondary school student must enter school campus from this entrance. No exceptions to that. Likewise, we have entrances on the primary school where we have a separate entrance for EY1 and EY2, and June and Jerry will talk about that. We did have a session yesterday for the EY parents, and hopefully the plan for their children to have access is clear. There have been some questions about an afternoon van schedule that had been, I think, at 1:10. We've needed to change that to 1:30, but you can see we've added that. So here is the updated van schedule. And again, we are required to have reduced capacity on our buses to 50%. And as has been mentioned already, we've got the school pass must be presented to the shuttle driver. That would be the screening point for those students, is right before they get on the bus. Okay, Becky, any questions you think that were based on campus access or anything like that?
There's a couple of questions about why are the students not on campus every day, and about why primary are not on a 2-week rotation, the same as secondary. So there's a couple of questions about that.
Okay, Mike and June, would you like to briefly comment on that for this group, and then we can get more specific in our
the secondary school are always on an AB week. That is their regular schedule, and we are always on a 1-week schedule. That's our regular schedule. I do think personally and professionally, to have students in the primary school come in every other week would be disadvantageous to their learning, especially as the students are younger. Retaining information for between 2 weeks would be quite difficult and hard to follow on. So for the model that we've put together, the students will have weekly access to the teacher, and will have a schedule that they follow for all 5 days, which I believe for the primary school is the best way to approach this. And I know that Mike's schedule is related to how the secondary school operates as well. So we've tried to keep it to our schedules and ensure that we're providing the best environment for the students.
Okay.
Yeah, for secondary school, we're really looking at safety. We're looking at what we believe to be the intentions of the government guidance. And so that's why we are having the rotation that we are. It significantly decreases the total number of students on campus at any given time, which as a result of that maximizes social distancing, and also improves our capacity to prevent intermingling between different groups, which could cause more widespread, infection across different groups and things like that. Excuse me. Okay. In terms of why we're doing 4 days, I think that is something that will be up for review. I'm having quite a few conversations about everything with my teachers with relation to this. It seems unlikely to me that we will have the exact same model be in place for months and months and months and months. Things are going to get better or things are going to get worse. And so as a consequence of that, the exact model that we'll be executing is going to evolve over time. One of our original intentions with the Wednesdays was, I think, twofold. One, we did want to have a chance to really do deep cleaning on the campus and make sure that we were cleaning things, very, very thoroughly and disinfecting and things like that. The other idea is, at the point when we needed to make our plan, we didn't know the total number of students who would be participating in a hybrid learning model where they were choosing to stay home. If you ask people who've been working, or if you ask people who've had children in hybrid learning experiences where 50% of the kids are online and 50% of the kids are at school, it's frankly not a good learning model. And it's very stressful for everyone, and it's not as productive. And so part of that was to maximize the social benefits of face-to-face learning, while also maximizing the academic benefits of what we believe is a high quality remote learning experience. So students would be learning very well in the remote learning experience. Paul?
Okay. Yeah, thank you, Mike and June. Yeah, one quick comment that was mentioned in both of those responses. We continue to monitor, we continue to watch, and nothing is set in stone forever. So I think that we're really conscious of a reopening after quite a bit of time on remote learning, and we're being cautious. There's no doubt about that, and no apologies for that, because we want to be as safe as we can. but we will continue as we reopen. We'll be looking at things, and if we can make some changes that we think continue to be safe, but are in the best interest of teaching and learning, we will definitely make some changes in the future. Okay, you hopefully have seen these flow charts. I think we have provided these not just for families, but also for us, so that we're aligned in our thinking in different types of situations. The preparation of these flow charts have come from looking at a lot of different possible scenarios, and again, referring to government advice. So we're feeling, be assured that we have very clear processes to follow in particular situations. What we're trying to do, though, is to minimize any of this needing to be necessary, and that's where the Swiss cheese model comes in. But in the event that we do need to respond, we are very ready for that. So this is a flow chart for students. We have another flow chart for faculty and staff, which are essentially the same. And then this is a flow chart for you at home after taking the ATK test. If it's a negative test, then it's fairly straightforward. If it ends up being positive, then that would prompt you needing to get a PCR test within 24 hours and then follow the pathways that you see on that flow chart. And we have established, because this can often be confusing for communities, is, if there does end up being a confirmed positive case on our campus, definitions of, definitions of both who and then circumstances related to that person that would then impact our reaction and our response as a school is on this slide. Okay, our vaccination data continues to go up. So actually this could even be a little bit outdated, but in a good way. It just means that the unvaccinated parts of those pies are continuing to be turning into vaccinated. So in our secondary school, you can see that this is happening. Now, I did want to make a comment here because I know this has had some concern from families who our intention of sharing this data is not to say that one is good and one is bad. I mean, obviously from a health standpoint, we want to have as many people vaccinated as possible, and that will contribute to community safety. But if your child has not had access to a vaccine, we are welcoming them as much to school as we are the vaccinated students. There's no stigma attached to it. And we're going to really be looking at our communication, but the purpose of sharing these pie charts with you is to instill community confidence about our levels of vaccination. Our staff, I can confirm after a conversation this morning that all of our employees, we have 4 employees who have not been vaccinated, and they will not be allowed on campus until that happens. So they are going to be working remotely. But everyone else on our campus has been vaccinated. So that's great news. Okay, and lastly, in our plan here are some scenarios that were just meant to kind of make it more tangible about some of our responses should there be an issue. if a student, teacher, or staff member has a positive test result, but isn't showing any symptoms, then that person would stay home and need to get a PCR test. If they do have a positive, if they have a positive PCR test, the classroom is advised and that patient would stay home for 14 days. If patient A has had close contact with their classmates in the past 4 days, classmates are also sent home for observations for 4 days or until the next negative ATK result. And then if patient, if the person who has had the positive, if patient A has negative PCR results, they can return to campus. So we, you know, back to those other slides that showed our responses. This is just hopefully clarifying a little bit more carefully what we would be doing in the case of a positive case or a suspected positive case. Okay, so we've got a few minutes left of this meeting, and I'd like to maximize the number of questions. Here again, in the reopening packet that we sent on Friday, you have definitions here so that we're all speaking similarly on this topic. We can really get using a lot of acronyms here, so this is a good idea just to make sure that we're not taking any meaning for granted. Okay, so Becky, any other what you would kind of see as high elevation questions that would be best suited for this meeting? And then we'll continue to look at all the questions as we go through the series of meetings that we have this week and next week.
So there are a few more comments about the use of the saliva test, requesting that we look into that for secondary. So as I've said in the chat, all of your questions and comments, we will download them because there's quite a few questions. I hope that we've addressed as many of them as we can. The saliva test, we're unable to comment further on that at the moment, but we will take that into consideration. So all of your questions are being noted. So please, you know, be aware of that and be reassured by that. There were some questions that were quite program specific, divisional specific. So I hope that those parents will be going along to those sessions. But just in case, there was a couple of questions asking when the primary school students will know which group they are in. And I suppose that would apply to, oh no, secondary are in all the time. So primary, so June, I don't know if June's gone to the CIS meeting. You still there, June?
No, I'm still here. May, Aim and Jerry are working on this as we speak. So we should be able to get something out by the beginning of next week. By the Monday meetings, we should be able to have those groups assigned. Just bearing in mind that we have received some requests for specific days. We will do our best to accommodate that, but I can't promise anything because we do need to have equity in groupings. We don't want to have, you know, 3/4 of the students on Monday and Tuesday and very few on Thursday or Friday, or the other way around. And we are trying to accommodate primary school siblings. So we're trying to ensure that if you have more than one child in the primary school, that they will be in school on the same day. And that's our priority. So working from that, we'll be then looking at other requests and making sure that we are able to accommodate as many of your wishes as possible, but I can't promise specific days at this point. But do let me know if you do have specific days that you need for your own schedules. Thank you.
There are also a couple of questions about how the hybrid program would work with some students being in school and some students being out of school. And that's different for the primary and the secondary. So June, do you want to just give a brief overview for those parents that come later?
So what we're looking at is something very similar to what we are doing with the remote learning. But what we will be doing then is adding value to that at some academic aspects whilst the schedule will leave. And then on Monday and Tuesday, that will become, will be adapted to be in person and have the added value of face-to-face learning and assessment and things like that. Then on the Wednesday, everybody is remote learning. And then on the Thursday and Friday, the other group will come in and do the remote learning. But the underlying schedule is the same. So there's no repetition of learning and there is no confusion. Now, we have had to adjust those schedules because of the model we have. The specialist teachers cannot go into the bubbles. Otherwise, someone like Chris, for instance, with music, would go into every bubble to teach music, and that would totally, there would be no point. So some of those classes will still remain online, and we have allocated one specialist to each grade, but they will continue with their remote learning. So we will be sending schedules, teachers will be in touch, and we will work that through with all of you so you know what's happening.
Okay. Well, I think we've come to the end of the time for this particular session. As Becky has mentioned, we will be capturing all the questions in the chat and continue to work to try to answer as many questions as possible. My intention is that we, as much as we can before we actually begin school, have as much basic understanding for some of the big components of our plan as possible. So I think having everyone understand the basic process involved of the ATK tests, what's permitted, what's not permitted. We are reviewing that, but as of now, this is what we're going to need to do. So until further notice, I think what we have shared with you is what we will, what is required at the school. And then some of the divisional, I would encourage you, if you have still enough questions to where you're uneasy, please attend the secondary school and the primary school sessions so that you have additional opportunities to answer questions. Becky?
Yes, I'll just chirp in here, and someone mentioned it in the chat. We will make these questions like an FAQs list available to all parents. So there will be somewhere for you to go to just check where we're at. And those questions, the answers may change as we get more information, but we'll keep those up to date.
Okay, well, on behalf of the school, the senior leadership team who've joined me in this call, I do want to say thank you for your participation. We've had almost 200 parents at one point in this call, which really says a lot about community engagement, and we really do appreciate it. We're excited about the start of school, and I hope you are too. And we will just continue our communication as the days proceed. So thank you very much, and hope to see you in some of the other sessions. The secondary session, I think, begins at 10 o'clock. Is that right, Mike? So.
Yeah, that's correct, Paul.
Okay, so that's in about 10 minutes. It is a different link, I think. So you'll have to log out of this meeting and click the link for that one. And then the primary school meetings are on Monday. So thanks again, and good luck with your preparations. And we will certainly.
Sorry, Paul, can you not kick people out? Someone asked for the link for the next meeting, and I'll put it in the chat box. So just, yeah. Colleen is on top of it. So if you're looking for that link, it's in the chat link already.
Okay, wonderful. All right, well, thanks everyone, and have a wonderful day. We'll be in touch. Thank you very much for coming.